Hey guys, and welcome to the second episode of Heart and Lungs. Today we're going to talk about cystic fibrosis because this is a condition that physiotherapy plays an integral part in. Cystic fibrosis is a genetic disease. You may call it congenital, something that they are actually born with. 1 out of 25 of us carry the faulty gene without even knowing. It occurs in people who have inherited two faulty genes from their mother and their father, causing a mutation in the CFTR gene, which is the cystic fibrosis transmembrane conductance regulator gene. This basically helps out with the movement of salt and water in and out of the cells. The signs and symptoms of cystic fibrosis, or CF, are salty tasting skin, poor growth and weight gain despite normal food intake, accumulation of thick mucus, recurrent chest infections, coughing, and shortness of breath. Many people, when they hear cystic fibrosis, immediately think that the mucus only affects the lungs. It does affect the lungs, but it also affects the pancreas. The pancreas, situated just behind the stomach, provides enzymes or digestive juices that help to break down food. It also produces insulin, which helps to regulate the body's blood sugar level. In patients with cystic fibrosis, however, the accumulation of thick, sticky mucus blocks the movement of enzymes traveling from the pancreas to the stomach, resulting in irreversible damage called pancreatitis or inflammation of the pancreas. Now, because the enzymes or digestive juices are not being sent to the stomach, food is not being broken down, resulting in the body not receiving any nutrients. This leads to one of the signs and symptoms of cystic fibrosis: poor growth and poor weight gain. And also, as some of you may know, the pancreas produces insulin. Once the pancreas is damaged, the production of insulin is diminished, causing cystic fibrosis related diabetes. So why does a faulty CFTR gene cause a rise in mucus levels? Well, here's a little pathophysiology. The protein that is created by the CFTR gene acts as a channel connecting the inside of the cell to the surrounding fluid. This channel is responsible for the movement of ions in and out of the cell. A mutated CFTR gene produces a protein that cannot do this, resulting in an imbalance in ions. More specifically, it leads to an excess of chloride ions, preventing the reabsorption of sodium ions. You bring sodium and chloride together and you get sodium chloride, something we all know as salt. This is why the skin in those with cystic fibrosis tastes salty, due to the perspiration of sodium chloride. Back to why there's an increased level of mucus. Well, the cause is not currently known. However, there are several theories out there. A popular one is that the imbalance in ions causes dehydration to the cells. When a patient who's fairly chesty, who appears to be unable to expectorate any secretions, one of the first questions we ask them is, are they drinking water? Because water helps to keep the mucus less viscous, making it easier for the patient to bring it up themselves. So by being dehydrated, the thickness of mucus is increased. Cilia, which normally resides on the top of the cells, help to move the mucus along, up and out of the body. However, it struggles with viscous, sticky mucus, which causes a build-up. This build-up of thick, sticky mucus becomes a friendly place for infections and bacteria to hide, causing damage and infections. Most of the damage caused by cystic fibrosis is caused by the blockage of channels, and this is where physiotherapists can help. Granted, we can't do much about the pancreas, however we can help the lungs. Here are some of the things that physiotherapists may do to help those with cystic fibrosis. They may provide breathing exercises such as ACBT or active cycle of breathing techniques, or autogenic drainage. They may also provide physical exercises or postural management support. But one of the most important things that they can do is inform and educate the patient and the family so that they can continue self-managing at home. Physiotherapy is a vital part of improving the quality of life of someone with cystic fibrosis. I hope this video has helped you understand a bit more about the condition. Until next time, take care and I'll see you later.